Welcome to the Intercept live broadcast. I'm Mehdi Hasan, coming to you live from my lockdown home in the DC metro area. I'm sure you're all at home, I hope, watching this broadcast. We're going to spend the next 30 minutes talking about the coronavirus crisis. What else? Different aspects of it with two colleagues of mine from the Intercept. So do stay tuned for an important discussion. I wish I could be the bearer of good tidings, but I'm not. The situation is still bleak. More than 800,000 confirmed COVID-19 cases around the world. That number will soon hit 1 million. More than 100,000 cases in Italy, almost 200,000 cases here in the United States, where the death toll from the virus has now crossed 3,000. More people have died from COVID-19 in the United States than died on 9/11 or than died in Puerto Rico during Hurricane Maria a couple of years ago. It's truly tragic. It's horrific. And it's affecting all aspects of society. But here's what's interesting. You know who's doing well out of this crisis? Who's making money out of this crisis while undoubtedly performing a vital public service? The big online stores, the grocery stores, the Whole Foods, the Amazons, delivery services like Instacart. But here's a question I want to pose today. Are these big companies, as ever, even in the midst of this coronavirus crisis, putting their own profits ahead of the people who make those profits for them, their employees, their workers? I'll be speaking to my colleague Alleen, who's been covering this vital story for us, the walkout at Whole Foods today by workers, by Amazon employees and others, later in this live broadcast. But first, to talk about the different experiences on different sides of the Atlantic, to talk about how a country like Italy is handling the coronavirus crisis compared to a country like the United States, I'm joined by my colleague Alleen Speri, who is a reporter for The Intercept. She writes about immigration, justice, civil rights. She's originally from Italy. She lives in the Bronx, but right now is in Veneto, which is one of the hardest hit regions in northern Italy, next to Lombardy. She's quarantined, I believe, at a relative's house in the countryside with a very slow internet connection. Just a heads up if we have any issues during her live stream. Alleen wrote a recent piece for us called "Why I'd Rather Be in Italy for the Coronavirus Pandemic," which I urge you all to read. And she is, in fact, in Italy right now. Welcome, Alleen. Can you hear me?
Thank you so much for having me. Yeah.
Alleen, before we get into why you're in Italy and what's going on, as you explored in your article and the responses between the two countries, let's just talk about the situation on the ground. How bad is it in northern Italy where you are right now?
It's bad. It's absolutely tragic. I mean, the numbers are absolutely horrifying. As you mentioned, more than 100,000 people have tested positive. The latest numbers are that 12,400 people have died as of today. And we expect that to continue to grow for several days at least. We're seeing several hundreds, up to upwards of 800 deaths every day right now. But that said, everybody has been talking about, flattening the curve here as they have in the US, and people are watching that curve very carefully. And it does appear that Italy is peaking right now, and it seems like the rate of infections is actually slowing, which suggests that social distancing measures have been working. I mean, Italy has been on the entire country, 60 million people, has been on lockdown for more than 3 weeks now, and a good chunk of the country was on lockdown before that. So it's been several weeks now of social distancing, and we're starting to see an effect, although it's way too soon to say whether we're out of the woods. It's clearly tragic.
Why do you think it is that Italy was hit so hard so early on and became one of the early epicenters in the West for this crisis?
Yeah, I'm not sure Italy was hit harder than other countries necessarily. It was hit first, and as other countries have struggled to come to terms with this crisis, Italy responded relatively late. I mean, there was definitely a good few weeks of denial when we all kind of went on about our lives and didn't take this seriously enough, and that obviously worsened the crisis. But a lot of other European countries are unfortunately catching up in terms of numbers. And when I wrote the article that you referenced, there had been 1,000 deaths in Italy. There are now 3,000 in the US. That was 2 weeks ago. And so obviously I hope to be wrong, absolutely, but it seems like Italy was kind of an early country in facing this crisis. Although there are factors that are unique to Italy. We have a very old population, and we know the coronavirus in Europe and in China has tended to impact older people and people with pre-existing conditions. In the US, that seems to have been a little different, actually, but that's certainly been an issue in Italy. Also, we have a lot of members of the same families from different generations living together in close quarters. There's more social interaction than in other countries, which I'm sure has been a factor as well. But also Italy has been testing pretty aggressively fairly early on in the crisis, which has led to a much higher number of cases, partially because we were reporting them. And it is not necessarily the case that other countries don't have those cases, they just don't know. And we're seeing something similar in New York now, as New York State kind of becomes one of the few states in the country that is testing more. We're seeing the numbers go up, which doesn't necessarily mean other states are probably just testing for it.
I think Americans will, in days and weeks to come, realize that the whole numbers game was absurd. It was just the fact, as you say, that other countries were testing more and earlier. And it wasn't that the United States didn't have its own crisis domestically. It's just that we didn't know about it and wanted to keep it that way. See no evil, hear no evil. And to quote Donald Trump's weird, why should I let the numbers go up by allowing a cruise ship to come back? Let's talk about your piece that you wrote a couple of weeks ago. You wrote a piece called Why I'd Rather Be in Italy for the Coronavirus Pandemic. And you actually did go to Italy from New York. Why? Why would you go there from the US weeks ago?
Well, first of all, I came for personal family reasons. I mean, I think one of the hardest things about this crisis has been hearing about people going to hospital, dying in hospital alone, not being able to visit their loved ones, not being able to be close to them. And for me, living, a 10-hour flight away from my family, just the idea of not only not being able to get to hospital, although thankfully everyone has been healthy so far, but also the idea of being in a different country with airports closing, with flights being canceled was just very difficult. So I decided to come back at a time when I sensed things were about to get worse in the US, but everyone around me seemed to kind of carry on with life as usual and not really take it as seriously yet. So in a way, I felt like I was warning everyone at home that, at home in New York, this is going to come here too. And I hadn't quite, I had followed it in Italy all this time. But the bigger point of the article, though, is not so much about kind of like my personal preferences, but really the different kinds of systems and sets of values and policies that these countries have to deal with a crisis like this, right? I mean, in Italy, the situation is devastating, but it is a healthcare crisis, and it is mostly that alone. I mean, obviously the economy is suffering and people will have a hard time, but there isn't a sense of kind of utter disaster and social collapse and just massive despair all around. And that is the sense that I am getting, certainly in the US, certainly in certain communities in the US, the ones I cover most, certainly back in the Bronx.
And why do you think that is? Is it because of the different economic systems, healthcare systems? What is it?
Healthcare system, I mean, that's a given, right? Italy has free universal healthcare, always has. It's not, it's a system we've had in place for decades. So people are, yes, worried about getting sick, but they don't have to worry about whether they're going to get tested and whether they have to pay for those tests and pay for their care. That's just not an issue. And, you don't need a doctor to know that the kind of stressing about all those factors is not good for your health, and doesn't help in a situation like this.
It's not just a health situation. It's the idea, and a lot of experts have pointed out that the reason why the US is going to be so uniquely hit hard is because when you don't have free healthcare, when you're worried about bills, you don't go to the hospital in general. You just stay away from healthcare centers. You tend not to have a doctor even to turn to in times of crisis, and therefore people are less likely to come forward, less likely to get tested, less likely to get treated, and that makes it spread even more. And that is a real problem, as you say, in terms of the comparison between the healthcare system. You now have people like Joe Biden coming out and saying everything should be free in relation to the coronavirus, which of course raises questions: why only the coronavirus? Why not cancer? Why not other conditions?
And that's the thing in Italy. It's not that the system is perfect, although it is a very good system. The healthcare system in Italy is consistently ranked among the best in the world, and it's still under strain, which says a lot about countries that don't have that. But it is just the fact that Italians are accustomed to have that system there. They know it's there for them. They know they can just go to the hospital if they need to. It's just like a part of life, and it is not a political issue at all, what administration we have, and we have over the years. It's a system that we can constantly rely on, and you have a sense of confidence in the system when it comes to the broader social safety net. I mean, again, not a perfect system. There are definitely many problems, but Italians have tools in place like paid sick leave. They have a wage guarantee fund that is there at all times, and so when you have a time of crisis, like you can tap into that. Yeah, sorry.
So I just want to ask you, we're having some issues with your picture, but your audio is still great, so I'm glad to still have you here. But let me just ask you this. You went into the crisis, Italy, as you say, with a system that had paid sick leave, free universal healthcare, etc., which obviously puts you in a bad place despite all the horrific suffering we've seen coming out of Lombardy and Venice and other places. But tell me what's happened since. You've been there for the last couple of weeks. In the US, we had a quote-unquote stimulus package or rescue bill, which Congress passed before they all decided to go on vacation. You were telling me before we came on air that the Italian government is doing decrees on a daily basis and doing things like moratorium on mortgage payments. What else?
We've had, so we already had paid parental leave, we'd have extended paid parental leave, we'd had babysitter vouchers because the schools have been shut down here for more than a month in some regions. And so to help parents, we have had, as you said, the moratorium on mortgages, bill, care insurance payments. There are subsidies for small businesses, which don't only cover the wages for the employees, but also cover, rent, utilities, any other costs the businesses might have, so they don't go under, so they don't have to start over once the crisis has passed. We haven't had a moratorium on residential rent yet. We have had a moratorium on evictions, but people are asking for a moratorium on rent. I imagine that might come. There are new measures being presented almost every day. There are cash payments for people that are temp workers, freelance workers.
I think is there a monthly payment of 600 euros a month is the cash direct payment, which is around nearly $700, which is interesting because here they passed $1,200 check one-time payment, which won't even get to people for several weeks. Whereas the Europeans, like the Italians, like the Dutch, like the Danes, like the Brits, even the centre-right Brits, are doing monthly payments in anticipation that this crisis is not going away anytime soon.
Right, and there are other measures that localities are empowered to also help the people that need it most. There's a €4 million program going out to towns and cities for grocery vouchers for families that need them, and then a host of other measures like this that are just kind of building on top of this social safety net that we already have. And again, not a perfect system. Many people are complaining that it is not enough, that there are, the rent moratorium, for instance, is something people are asking for. But it is a system that's there. So people know they will not be completely ruined over this. They might struggle. There will certainly be businesses that do. But it doesn't have this kind of end of the world feel and panic that you get in the US, because people know they will be fine. It won't be easy, but they'll be fine. There will be a government there to take care of them. And it's not. It's an
interesting sentence to use. People know they will be fine. There's definitely not that sentiment here in the United States. There's a sense of hopelessness and despair amongst people across income and class ranges. People just staring into the abyss. Because I think people deep down do know that the US system was just not ready for this. I interviewed AOC recently on the podcast. She made a very good point that this crisis has basically taken all the pre-existing crises about income inequality, climate injustice, etc., and basically put it on fast forward.
And that was exactly the point of my article. I mean, the health crisis in Italy is major. It's unlike anything most of us have ever seen. But it is a health crisis, and it can be somewhat contained to that. Of course, there will be spillover effects on the economy and other things, but it is. It does not feel like the world is collapsing around you the way it does for so many people in the US. I mean, and that was really my point. As you mentioned, that the inequalities that are such a key part of everything in the US, whether it's access to healthcare or everything else, they're just being magnified a million times over by this crisis. And the sense of insecurity that so many people already have, people living paycheck to paycheck, are now finding themselves without that paycheck and seeing what it actually looks like when you don't get it. And so
without the paycheck and without the healthcare benefits that come with that paycheck, because you have a ludicrous healthcare system that's joined to your employment status. Let me ask you this: Italian friends and family members of yours, what do they say about the US? What are they asking about what's going on in the US? I'm intrigued because obviously you're dealing with your own problems there, but everything's relative. What do they think when they look across the Atlantic over here?
Well, so like my friends and family, I'm a U.S. citizen now. I've been living in the U.S. for years and cover social justice, racial justice issues in the U.S. So they're somewhat accustomed to the U.S. is not this perfect country that it's so often made out to be. But I think there is a sense of pride, actually, surprisingly, in Italy. Italians tend to be very harsh on themselves, and for good reason. Most of the time, they tend to be very critical of their government, again, for good reason. But there's been a really kind of new and unique coming together of Italians and feeling this sense of kind of shared responsibility. And yes, we have people that are violating the lockdown and people that, went skiing in the early days of the crisis. And we definitely have, Italians kind of trying to outsmart the system, as we have a reputation for, in a sense. But there's really been this coming together of people that I think has been very, really incredible to watch, actually. And it's not just people, coming out to their balconies and singing together and just kind of showing solidarity in that way, although that's been important too. But just a sense that, we are there for each other. The country is there for us without being a perfect country, but that's just because, it's there because that's what countries do. It's there because that's what we expect of our government, our institutions. And there's been a good amount of patience, actually, from people that have been stuck at home for a month now. and kind of like willingness to go with it, because we understand it is for the greater good.
So last question before I let you go. You made this journey back from the Bronx, New York, to northern Italy. What was that journey like in the middle of this crisis, like going back from the US to there? How did you get back home?
There were flights. The Italian airline guarantees flights back to Italy. I think right now it's the only airline that flies there. I was expecting an empty flight, and actually I couldn't get a seat. Everything was sold out. And a lot of the people on my flight were Italians who live in the US like myself, who just kind of figured things were about to get much worse in the US. Then once we got to Rome, we had to take trains to come up here, and the whole country was empty, which was very surreal. There were army checkpoints at every station where we had to justify our travel and explain what we're moving. So there's definitely a very strict lockdown in place, much stricter than it has been in the US for now. But there's also a lot of willingness to willingness to participate in that as a kind of communal effort to stop this.
Well, I'm glad you got back safely. Alice, stay safe. Keep up the great work that you're doing. Thank you for joining us on this live broadcast.
Thanks.
That was Alice Speri, my colleague for The Intercept, a reporter for The Intercept, now back in Italy, in northern Italy, from a relative's house in quarantine, joining us via a spotty Wi-Fi connection there to give us some rather important insights into the differences between what the United States is going through and what certain European countries are going through. To read her piece, Why I'd Rather Be in Italy during the coronavirus pandemic, follow her on Twitter. I'm joined now by my Intercept colleague, Alleen Brown, who is a reporter focused on justice and environmental justice issues. She joins me now from Brooklyn, New York, one of the hardest hit part of that city. She's the author of the new piece, No Masks and Uncertain Sick Leave. New York Whole Foods delivery workers say Amazon is failing to protect them. Alleen, thanks for joining me on this live broadcast. Oh, I think you need to unmute yourself.
Thank
Perils
you.
of live broadcasting. Thanks for joining us on this live broadcast.
Thank you so much for having me.
Alleen, for those who aren't following the story about Whole Foods and Amazon and Instacart that you wrote about today in great length and great detail, just give us the gist of it. What is going on there?
So over the last few days across the U.S., workers for some of these workplaces that have suddenly become essential have gone on strike, held sick outs, and walked off the job. And so the type of workers I'm talking about are grocery workers, Amazon workers, and folks doing delivery. So today, the part of this that I wrote about in the most detail is Whole Foods workers who held a sick out today. And, among the things that they're demanding are double time hazard pay over the course of this crisis, paid leave for all workers who self-isolate, healthcare for part-time and seasonal workers, better sanitation equipment and social distancing policies, and the shutdown of facilities where workers have been diagnosed with COVID-19.
So basically, they're asking for the right to stay alive, from what you're saying.
Exactly. There's been this outpouring of gratitude, including by the owner of Amazon. Amazon owns Whole Foods, for these so-called essential workers who, folks who normally wouldn't need their groceries delivered to their homes are suddenly relying on these folks for survival, essentially. And these low-wage workers are risking their lives to perform these tasks while lacking proper equipment to protect themselves and sick pay. The ability to
just to be clear for people watching. Amazon, as you say, which bought Whole Foods a couple of years ago, they do guarantee some rights and they have raised some pay, $2 an hour to some of their employees. There's a distinction here when we talk about Amazon and Whole Foods employees between full-time staff and contract workers. Am I right?
Exactly. So Amazon has released some new policies. For example, workers across the board are getting $2 in essentially hazard pay, $2 an hour in hazard pay. And some of the contractors are getting that as well. Jeff Bezos, the owner of Amazon, has also promised workers 2 weeks paid sick leave if they are diagnosed with COVID-19 or go into quarantine. And for contract workers, he's sort of made an attempt to offer an equivalent via this fund called the Amazon Relief Fund. So if workers working for contract companies, most delivery workers who deliver groceries for Whole Foods or retail goods for Amazon work for these contract companies, those workers should have access to this Amazon Relief Fund. It's there's $25 million in the fund.
Yeah.
People submit a bunch of documentation and apply, perhaps they can get some money. But in New York, I spoke to a few delivery workers working for Whole Foods, for contract companies, who say they've never even heard of this fund. The sense that the workers I spoke to have is that these policies that have been introduced are sort of a cosmetic sheen that gives the appearance that Amazon is protecting its workers, but don't actually provide protection or make people feel
that relief fund.
Go ahead.
That relief fund, correct me if I'm wrong, didn't they ask for public donations to that fund too?
Yeah, exactly. So in addition to the $25 million that's already there, they've also solicited public donations. Again, Amazon.
They being Amazon.
Yeah, Amazon is owned by the richest man in the world.
The richest man in human history. I believe he's worth $117 billion. And just for people watching who know that Bezos is rich, understand how rich he is. And in February, he purchased the most expensive house in Californian history. He bought a $165 million mansion in Beverly Hills, I think, which sits on 9 acres, 13,000 square foot, has a golf course, has a movie cinema, has epic-sized pools. This guy in February is doing that and is now saying, hey, members of the public, can you help support my staff? And guys, you'll get a $2 pay rise as long as you're not a contract worker. I mean, it's pretty disgusting, I'm sorry to say.
Right. It's shocking. And, it's one of the kind of it's sort of a symptom of the strange moment that we're living in, that, again, the richest man in the world is suddenly sort of responsible for the workers that we're all increasingly relying on. And
they are providing a public service in many ways. I mean, grocery workers have been deemed essential workers in many states.
Exactly. And yet they don't have these basic protections. And, not only are they sort of unable to comfortably take time off when they need it, whether they've been exposed to someone who has been diagnosed with COVID-19 or are experienced symptoms, these are some of the only people that some of us are now interacting with. So their health is, reflective of all of our health. It really is a question of public health that these workers be protected and feel really comfortable taking time off when they need it. And kind of in a signal where we've yet to see exactly how Whole Foods might respond to the sick out that's happening today. But yesterday, the company Instacart, workers for the company Instacart, which provides delivery groceries via gig workers that use an app sort of like Uber, those workers went on strike as well. And a couple workers at a couple different warehouses for Amazon, where there have been cases of COVID-19 among workers, held walkouts. Amazon, in response to the walkout in Staten Island, where there had been multiple cases of diagnosis, Amazon fired the key organizer of the walkout, claiming that he had failed to follow social distancing practices or quarantine when he was supposed to, as if this has been some kind of priority for this company.
Yeah, you have in your piece, you cite delivery workers, you cite warehouse workers saying to you that keeping 6 feet distance is virtually impossible inside some of those warehouses. So it's ironic, a bit rich for Amazon now to be using that as an excuse to fire someone when we all know why they really fired him. One quote that jumped out from your piece, Alleen, before we finish, I'll just put it to you. A delivery driver who told you that he's unimpressed by the outpouring of thanks from the public, from people like Barack Obama on Twitter. He says, I think people who say thank you to me are misunderstanding the situation. I'm not at work because I'm trying to help people. I'm at work because I need to pay rent or die.
Yeah, exactly. I mean, you've seen, people going outside and clapping for essential workers. It's very nice, but what these people need is fair pay and sick leave. And I think there's a question now too about what can people do in solidarity with these workers. I think we should keep our ears open for what they say. But one thing that I heard from a number of workers is that one thing you can do if you have to order Amazon goods or delivery groceries, tip your workers as if they're risking their lives to deliver goods to you, because they are.
Alleen, thanks so much for coming on the broadcast. Thanks for writing that very important piece. I urge you all to read Aleen's reporting on Whole Foods and Amazon and Instacart. It's an important story, and it's not going away anytime soon. Thank you all for tuning in to this live broadcast. That's all we really have time for. I would say this to all of you watching, that for me, covering this story for the last few weeks, it's been very abstract, reading horrific stories about people dying or getting ill second, third hand, reading reports in the Times and in the Intercept and elsewhere.